Good morning, ladies and gentlemen. It's a pleasure to be at the summit. It's an honor and a privilege and quite a pleasure to be able to come before you and share with you a study that actually have been working on for the last 3 months. A lot of the work that we've been doing in this particular case centers around the whole concept of 4 risk factors: physical inactivity, obesity, diabetes, and smoking. The one thing that's particularly unique about this particular study is that rather than just focus on a statewide level, we were also asked to focus on each of the individual 67 counties. And so what I'm going to share with you is actually going to be amplify what the great points that Dr. Armstrong articulated earlier about what's going on not only nationally, but also within the state of Florida. When we look at why these particular risk factors were entered into this particular equation, each one of those risk factors, it basically has a strong relationship to lifestyle and the environment. In fact, 2/3 of these particular risk factors have a very strong relationship to what people do, how people behave, how they live their lives, and what they basically do in terms of their environment. When we look at a lot of the work that my associates and we literally have been doing this work for over 30 years. We've done those in these types of cost analysis in 8 different states that you see listed here, everything from literally from coast to coast, from Maine to California. We've done 2 different types of econ analysis in California, one in the state of Washington, state of Michigan, Massachusetts, Maine. We've done actually 2 in the state of New York. We have done 1 in the state of Texas and 4 in the state of North Carolina. So therefore, this, I believe, to my knowledge, is the first ever independent cost analysis on the economic cost of these risk factors done by someone from outside the state of Florida. So hopefully, you'll be able to see essentially how the state of Florida basically looks not only now, but also in the future. In the state of North Carolina, I'll just highlight a couple things right off the bat. We looked at 8 different risk factors, and we literally looked at a number of risk factors that, were tied to lifestyle and the environment. And what we basically found is that when we looked at that, the first 4 risk factors, were huge numbers of dollars, as you see listed on the screen. When we collectively added another 4, we looked at about 8 different risk factors. We looked at about 2010 economic cost dollars, $54 billion. Now keep in mind, the state of Florida has 2 residents for every resident in the state of North Carolina. So we would actually look at, if we looked at those risk factors and looked at risk factor prevalence rates, we would basically anticipate the state of Florida to probably be about twice as high as the state of North Carolina. It didn't happen that way, fortunately. The state of Florida is doing a little bit better job than the state of North Carolina in a couple of those areas. State of Maine, just to go to show you, in the state of Maine, we looked at risk factors, and there was a considerable amount, about 1 out of every $6. And this is kind of par for the course. We're basically seeing from Maine to California, and including the state of Florida, about 1 out of every $6 that we're seeing that are being spent on these particular risk factors that we're highlighting. State of California, here's some figures here. It goes to show you on obesity and California, and obesity and inactivity. In the state of California, because they have 36 million people, they basically have not just millions, but billions of dollars tied up in these risk factors. And what's important that we try to do in each of our states, including the state of Florida, we try to customize and tailor. We don't like to use generalized research. We don't like to use somebody else's data from another state. We don't like to use national norms. So this is a listing of the Florida state agencies. And I want to tip my hat right off the bat to the Florida Agency for Healthcare Administration. They were indispensable, and they're about the only state that we've ever worked with over the last 30 years that actually have an inpatient claims database on the residents of that state. I can't tell you from a data analysis standpoint how impressive that is and how comforting that is. Therefore, that allows us to create a valid and a reliable cost estimate without having to compare somebody else's state to your state. And these are just a listing of the different data sources that we were able to use by virtue of generating these cost data that I'm sharing with you today. Why is this economic cost analysis important? It's pretty obvious, isn't it? Dr. Armstrong hit the nail on the head. You basically can identify cost. You know which ones that are costly, not only from a medical care standpoint, but also lost productivity. And I basically want to hit the lost productivity element within the scope of my session here as well. But at the same time, it has direct implications for those of you that are in decision making in terms of programs, policies, incentives. Which of those risk factors should command immediate attention and immediate respect? We know across the board, 3 of these risk factors out of the 4 that we looked at are 3 of the most expensive medical care risk factors, as you can see on the screen. Somewhere in the neighborhood of $1,000 to $1,300 per capita. That means for each individual that has this, they would literally incur about $1,000 to $1,300 more than another individual without those risk factors. So we looked at the medical care costs. Now, obviously, the target population in the state of Florida, we try to capture as much as that target population. And we know that 3/4 of all adult Floridians have some type of health insurance, okay? About half of those that are 3/4 insured are insured by the private sector, by employers, the employer community. So we really want to look at businesses' costs, not just on the individual basis, but also at the business level. What we do from a methodological standpoint, rather than trying to tackle all the healthcare costs, we literally ask the questions, what kind of medical conditions are directly related to these 4 risk factors? We select what's called major diagnostic categories. You see those listed there. Then we divide them in terms of inpatient and outpatient. Either by major diagnostic category, we divide into a diagnostic related group, a DRG, and or an ICD. And so what we look at is that we really want to focus in on what are the costs that are borne by Florida adults and Floridians in general. Rather than just looking at the nationwide level, let's look at something within the particular state. Look at the risk factor prevalence rate. The yellow indicates the low, the blue indicates the statewide prevalence, and then the red highlights those counties that had the highest. Look at the vacillation. Isn't that incredible variation? It's not uncommon for us to see that. We've seen a little bit more volatility. For example, we've seen some counties in the state of Florida that have a risk factor prevalence rate that might be as low as 5 or 10%, and another county that might be 35%. Okay, so we do see some vacillation. And I might mention, in terms of the report, which we'll basically be submitting to the AIF Foundation in a couple weeks, we'll have 2 versions. We'll have an adult version that I'm sharing with you today, and a little bit, we'll also have a supplemental version that's known as the School Age Children, or SAC for short, SAC. So we'll have those 2 versions. We're just doing some copy editing on those right now, and we'll have those to the foundation within a couple weeks. Literally, let's just break these activities down real quickly. Is that physical inactivity guidelines call for, as the Surgeon General's talked about, getting some activity, at least minimum of 30 minutes a day, most days of the week, and a couple days of muscle building and strength building activities. And so that's really the minimum, just to be able to preserve your health. In fact, the recommendations call for twice that much, in order to be able to gain some maximum health benefits. In the state of Florida, you can see the inactivity rates have improved. They had to improve because you could see that both nation and in terms of the state, they were so high. 20 years ago, we literally had about 80% of all Americans, including Floridians, that were inactive. And now we basically see close to about a half, about 47.2% to be exact, are inactive, do not meet those guidelines. So it's almost 1 out of every 2. The noted columnist, cartoonist that I often use, out of the Raleigh News and Observer, he had this cartoon about 20 years ago. I think it's probably a little bit irrelevant to today's modern family according to Hollywood standards. But there's probably still a lot of truism here, isn't it? When you look at mom and pop and junior coming home from school, this is still the modern family in many households. And we speak about technology and so on. It's one thing to use technology. It's another thing for technology to use us. And again, I think that the Family Circus cartoon, I think the cartoons many times really are quite a self-fulfilling prophecy in many ways. So I hope that hits home. Before I share with you some of the cost data on the adults, let me just share with you some profound data on children in Florida by starting out with this. This is Newsweek. This came out about a decade ago. Can you imagine a magazine that's a news magazine with the front cover saying something as dramatic as Fat for Life? We didn't realize this was actually going to be, unfortunately, a self-fulfilling prophecy for many youngsters. And so when we look at this, about 9 years ago, there was evidence that came out that when we looked at trends, that the children in this country that were basically living the lifestyles that we talked about, that Dr. Armstrong pontificated about so eloquently, basically said that they may not live the longevity, much less the quality of life that you and I have. Can you imagine leaving a legacy to the little boys and the little girls that we bear, that we're responsible for, and we're saying you're not going to make it to 70, you're not going to make it to 75, you're going to die of a chronic disease that we literally brought on socially? So we really have our challenges ahead of us. A couple of these slides I'm going to go through because Dr. Armstrong did an excellent job, and I'm not going to continue to repeat. You know that evidence, Florida youngsters. The one thing that really dawned on me when we got into this study, and we've done other school-age children studies, look at the number of hospitalizations for 5 to 18-year-olds in the state of Florida. Now, these are 3 years, 3-year rolling averages. On average, about 2,500 youngsters are hospitalized. This was unheard of 20 years ago. Unheard of. I talk to pediatricians all the time. Those of you that are in the medical community, you never heard of hospitalizations for type 2 diabetes. You didn't hear about it. But look at this right here. And it grew, and it's kind of softening up a little bit. We're starting to see some ease in the trend. But when you look at that, what we basically found is that in 2012 dollars, that the cost of diabetes in a school-age child population was nearly $11 million, just medical care. Forget about the opportunity costs that mom and dad have to take time off of work, or the anguish, the mental stress, and all the other indirect costs. That probably would inflate this 3 or 4 times. So really what we have as we really look at this is not only a challenge for Fat for Life in terms of children. We really want to coin that term and convert that, not Fat for Life, but obviously Fit for Life, okay? So you've seen this stats. Rather than just relying upon the BMI, the best index, obviously, if you're kind of leaning in that direction, or a youngster is, just have him go about 1 inch above his hip bone, called the iliac crest. And if you can pinch an inch, that's pretty good index that he's reached that threshold. Whether you're a man or a woman or a child, is that many times what we look at is trying to basically get that inch down to about a half an inch. You know, a little bit of fat's good. We need a little bit of fat, but we don't need so much that we're 20 or 30 pounds over our ideal weight. And this is basically, BMI is not perfect, but it's a good measure. Look at the year-to-year, 5 years, trend challenges. Every state in the union, Colorado was the last state. We never thought we would actually see Colorado change the colors, because they were the last state to change the colors that indicated obesity. Now, this is not overweight. This is not overweight. This is not 5 or 10 or 15 pounds overweight. This is obesity, where the individual on average is a minimum of 20 and many times 25 or more pounds over ideal weight. We cut out overweight in our analysis. We did that on purpose because we just really wanted to focus on indisputable, arguable, compelling data that there's no argument about the relationship between obesity and health. There is some debate in the issue about whether being 5 or 10 or 15 pounds overweight. There's no debate in the medical community over the last 30 years about obesity and what we're looking at here. Look at that. State of Colorado in blue. Lilly was the last one, and they turned the next shade, a couple years ago. So that Lilly tells us, on average, the average man or woman has gained about a half an inch in height over the last 30, 40 years. Look what they've gained in pounds. I've grown a half an inch, but I'm expected to basically handle about 27 more pounds. I can't do it. Can you imagine putting 27 more pounds on a half an inch? Average woman and average man. So you can see that we really have some incredible data in front of us. Florida basically has about 1 out of 4 of our residents is obese. That's a little bit better off in many cases in some other states. But you look at the body weight changes here, look at that. Look at that. Keep in mind that the average man and woman has increased in height 1/2 inch in that time. Okay. So, the cartoonist, Shu, I love to read Shu because he's so much, the scale looks back at him and said, man, what are you impressed about? And the scale says, you're digging your own grave with nothing but a knife and a fork. And so sometimes we can take a lot of lessons in life by just looking at some of these cartoons. They're painfully honest, aren't they? Very, very honest. And we know the evidence, there's a direct relationship between obesity and many of the medical problems that we see. And in fact, about a decade ago, medical doctors and researchers coined this relationship between inactivity and obesity and diabetes as diabesity. Not obesity, but diabesity, or otherwise cardiometabolic syndrome. Very serious. Inactivity, driving obesity, driving diabetes, and we start to see that, as you can well imagine, not at the age of 35 or 40, but now we're starting to see that at the age of 5, at the age of 10, okay? So, when we look at diabetes, obviously, it's very important that you get a A1C or a blood glucose. Preferably, you'd like to have an A1C because that's a better index about your glucose index over the last month or so than just taking a fasting. So I hope that you sometime in the near future, if you haven't already, keep a tab on your A1C level. Look at what's happened in the last several years. Every state, 50 for 50, has literally had a profound increase in diabetes. Now, part of that's obviously due, as medical directors will tell you, to our ability to be able to track and detect and identify better. No question about it. But that doesn't explain the dramatic increase when you look at that, almost a doubling at the national level and in the state of Florida, almost a doubling. Can you imagine what kind of profound impact this has not only on the quality of life, but also in terms of on medical care costs and for employers? The old storm has not, didn't come overnight, did it? Now we have forecast years, sometimes days and weeks ahead. Perfect storm started decades ago. And we've got all kinds. We don't have a laundry list long enough, do we? Okay? The state of Illinois is the only state in the union that requires physical education, for example, every year of high school. State of Illinois. All the other 49 states, it's optional from year to year to year. And when you look at recreational venues and all-you-can-eat buffets and all these things, a lot of these are lifestyle decisions, aren't they? Some of them are environmental, okay? But just the fact of sitting and sitting and sitting. So there's a lot of factors. As Dr. Armstrong's puzzle showed, there's a lot of pieces to that puzzle. What in the world are we going to be like, not in 2050. Well, where will we be in 2020? Lord have mercy. We may not, many of us won't be around in 2050. Okay? But I'm so fortunate, I'll be 98 years old then. Okay? But look at the state of Florida. Started out in its rich history, agriculture. Started a little bit of industry, mechanization, industrial revolution in 1950. Now we're in this science and all this technology. And what is the cost of progress? We kind of have to ask ourselves again, are we using technology or is technology using us? Hey, there's good news. Good news. Smoking is down. Smoking is down in the state and in the country. Thank God. It is coming down. It's not where we want it to be, but it's certainly moving in a good direction. Now, how do we go about quantifying the cost in the state of Florida? We actually use what's called, this is the actual template. This is on the state of New York, by the way. But we have individual spreadsheets in the report on each of the counties. So we actually use a report and we gather the data on each county, each of the 67 counties, from Alachua to Walton and everything in between. And we literally look at outpatient costs and inpatient costs, and we look at the percentage of adults that have that condition. And we basically look at what kind of weight each of those risk factors has on those conditions. So we started with about $156 billion of medical conditions. And what we wanted to ask, of all those $156 billion, what portion of that great big pie of those medical conditions is due to these 4 risk factors? Okay? And this is what we found. These are not in millions of dollars. These are not in billions. And I would also say, in all earnesty and honesty, this is conservative, because we practice in my econometrics firm, we actually take self-reported data, and many times self-reported data on obesity, on BMI and activity, many times is 5 to 10% below the actual rates. Okay? These numbers are conservative. Okay? But I'd rather be conservative and be more realistic than trying to hype something up for purposes of hyping it. Look at that right there, $10.65 billion, and this is just in medical care costs. So literally what we have is about $1 out of $6 that you see there out of medical care, and then about, what we have here is about 16% of that total cost is just those 4 risk factors, okay? And we've done that for each county. This is, for example, in Orange County. This is a profile in Orange County on medical care. We took the prevalence of Orange County residents, their medical care claims, the overall weight, what they're basically paying on average, and Orange County is paying about 8.5 cents less on the dollar than many other counties. They actually have a medical care cost inflation rate of about 0.91, meaning they're not paying as much money for these medical care services as some other counties. Some counties are 50, 60% higher. Some counties are lower. But still, even that conservative approach, look at that figure, $500 million in one county. Granted, it's a large county. Okay? Now, the other aspect that a lot of researchers don't do, they just say that the medical care cost of these risk factors is. We take it one step further and we ask the question, what relationship do these risk factors have to lost productivity? And as the previous speakers, including Dr. Armstrong said, is a profound direct relationship. And so we look at absenteeism, absenteeism, presenteeism, and short-term disability. These are the data sources that you see listed there on the left. And so we look at these 3, okay? And then really, the reason why we look at lost absenteeism is that for every dollar on the table for risk factors, there's probably 3 or 4 or 5 that can be explained in terms of these other lost productivity indicators. So if we just focused on medical care, you can see we only really account for 1/4 of the pie We don't account for the whole pie. And there's all kinds of data that's been published literally for 30, 40 years on the impact of obesity. Actually, we use 27 case studies in our analysis. We have 160 citations in the report, the 95-page report. We have 27 studies of actual work sites that have studied the relationship between inactivity and obesity, diabetes and smoking on these lost productivity indicators. So we don't use just estimates from somewhere. We actually have taken 27 published studies, and what we found is that these are the percentages. And you can see 3 of the 4 risk factors that we highlighted in here have pretty impressive lost productivity impacts. And presenteeism, of course, is really big. And so what we really do is we take each county in the state of Florida and we look at how many workers are in. We look at their pay scale, because there's vacillation from $25,000 in one county all the way up to $46,000 in Palm Beach County, for example. Incredible difference. We look at the prevalence of those risk factors, and then we look at these 27 studies. We have this particular equation, and this is the one for Alachua County. In a workforce of 164,000 employees, and the risk factor rate that we see in the city of Gainesville and the surrounding communities, you can begin to see how the dollars add up. And Alachua County is actually one of the healthiest counties in the state. It has very relatively low prevalence rates compared to most counties. But still, what we found is almost 7 cents out of every dollar that is paid is basically aloof. Almost 7% was attributed to these 4 risk factors. I can only begin to imagine what we would find if we looked at other risk factors. So this is lost productivity. So collectively, when we look at that, you can see the total cost when we factor in medical care, prescription drug costs, and lost productivity. It's conservative to say that these 4 risk factors have an impact in the state of Florida, conservatively, of close to $52 billion. $52 billion. Now, with that, what that would project it, we looked at about a 1.5% inflation, population growth. Actually, it's 1.35. We look at an employment cost index, in other words, the cost of doing business, about 1.8%, and then medical inflation, about 4.5%. When we factor those in, we do a projection, and these costs in a matter of 5 years would literally go up 25% with even that low inflation rate of 4.5%. They would literally go up beyond $60 billion. Now, here's the real kicker. Even though these costs aren't allocated and aren't directed and borne by individuals only or adults or work sites, I illustrated here, if we were to divide the $52 billion, 51.87, and we would ask every man, woman, child, and baby in the state of Florida to pick up their equitable tab, that would be the cost, over $2,000. Okay? And then we look at the adult. And then we look at, obviously, per worker, but look at the work site. And the work site, as you know, picks up the bulk of this tab. But if we took that whole sum and said, you've got to pay your fair share, this is the proportionate allocation. So it has incredible implications when we look at the growth of Florida. The great state of Florida is going to have continued growth. We got an aging population. We have risk factors that have not basically abated in terms of inactivity and obesity in particular, and diabetes, those particular risk factors. It has incredible implications that were noted earlier. And so we've really pretty well understood that we can't afford that on the medical care side. You know, this cartoon literally was created 30 years ago. I started, when I was in this business, starting out as a young man, this was one of the first cartoons that was published in the late 70s, early 80s. Can you imagine what we'd find? Now, to put it into perspective, a couple years ago, the budget was in the mid-60 billions for this state. For every dollar that we literally put into running this state, about 16% of that would be equal to the amount of money that those 4 risk factors cost. So you can see why the previous speakers, including Dr. Armstrong, and the initiatives that he and his office and at the state level are so very important to be able to initiate. Who pays what? Well, we basically broke down those $156 billion and asked the question, what does the state pay for those medical conditions? What does the federal government pay? What do individuals pay? And then what do businesses pay? Businesses pay about 36%. About 36%, a little bit more than a third. So literally what that would mean, we asked the question, what does the business sector in the state of Florida pay for these 4 risk factors? When we looked at the medical care costs, a shade over $4 billion, but remember, that's only small compared to the lost productivity. When we factored in the lost productivity costs, okay, and we added those together, you can see the risk factors, and inactivity and obesity are number 2 and number 1. And diabetes actually overtook smoking overall because of the lost productivity cost. If it was just medical costs, smoking was actually a little bit higher just on the medical side. But when we factor everything in together, the nice thing about this, folks, is the impacts that Dr. Armstrong and at the statewide level that were discussed earlier, if we could just make a 1% impact, not 5 or 10, but 1% impact, we could literally generate somewhere in the neighborhood between $592 and $610 million per year with a 1% impact. And this takes into consideration inflation, population growth, and so on. What would that mean? On an annual basis, look at that. The thousands of new workers. It would preserve what we have, but also build in a state that's got to have, obviously, more workers to provide, obviously, for the quality of life that we have for more citizens. So, eclectically, you know, as a group, it's very important that we have things in the schools, in the communities, in the work sites. It takes everybody to be able to work together. So when you look at that, really it comes down to what do we want for our children? Because basically what we want for ourselves is going to basically reverberate back to our children. Do we want to be fat for life or fit for life and be able to consequently enjoy the Great Peninsula for many years to come? Thank you very much.